Do you know that pistachios can be harmful for some health conditions? Yes, you heard it right. These little green gems, while delicious and generally healthful, may not be the best choice for everyone. It's crucial to realize that what's beneficial for one person might be detrimental for another, and pistachios are a prime example of this. From allergies to digestive ailments and even certain drug interactions, pistachios can pose significant health risks for some individuals. Let's explore the health conditions that could make pistachios a no-go. First on our list is nut allergies, a common health concern for many. Nut allergies, including those to pistachios, are no small matter. They are part of a larger group known as tree nut allergies, and they can pack a real punch. Imagine this: one minute you're enjoying a handful of these crunchy green nuts, and the next, you're experiencing symptoms that can range from uncomfortable to downright dangerous. These symptoms can include hives, swelling, and difficulty breathing. In severe cases, exposure to pistachios can even lead to life-threatening anaphylaxis, a severe and rapid systemic allergic reaction that requires immediate medical attention. Pistachios, like other tree nuts, contain proteins that can trigger an immune system response in some people. This response can be mild, like an itchy mouth or throat, or severe, as in the case of anaphylaxis. The tricky part is, even trace amounts of pistachios can set off this allergic response. They can lurk in unsuspected foods, like certain types of pesto, baklava, and even some brands of ice cream. Management of nut allergies focuses on avoidance. That means reading food labels carefully, asking about ingredients at restaurants, and, of course, not eating pistachios or foods that contain them. It's also a good idea to carry an epinephrine auto-injector if you have been diagnosed with a severe nut allergy. This device can deliver a dose of medication to halt a severe allergic reaction in its tracks until emergency medical help can arrive. In conclusion, if you have a nut allergy, particularly to tree nuts like pistachios, it's best to play it safe. The risks associated with consuming pistachios if you're allergic far outweigh the benefits. And remember, it's not just about avoiding the nuts themselves, but also foods that may contain them. So for those of you with nut allergies, pistachios are definitely off the table. Next, we tackle gallbladder disease, a condition that can be aggravated by certain foods including pistachios. Gallbladder disease encompasses a range of disorders that impact the gallbladder, a small organ beneath the liver responsible for storing bile, a fluid that helps in the digestion of fats. One of the most common forms of gallbladder disease is gallstones, which occur when substances in bile form hard particles in the gallbladder. Now, when it comes to diet and gallbladder disease, it's all about balance. A healthy diet is key in managing this condition, and it often involves limiting foods that are high in fat. This is where pistachios enter the picture. While they are packed with beneficial nutrients, pistachios are relatively high in fat. This fat content, while healthy in moderate amounts for most people, can be a bit of a double-edged sword for those with gallbladder disease. Why, you might ask? Well, fats trigger the gallbladder to release bile. So, when a person with gallbladder disease consumes a high-fat food like pistachios, it can cause the gallbladder to work overtime, potentially leading to discomfort or even a gallstone attack. Now, we're not saying you must bid farewell to pistachios forever, but moderation is key here. If you have gallbladder disease, it's important to be mindful of your fat intake. A handful of pistachios every now and then might not cause an issue, but regularly indulging in large quantities could potentially exacerbate your condition. Of course, everyone's body responds differently, and what works for one person might not work for another. If you have gallbladder disease and love pistachios, it may be worth having a chat with your healthcare provider. They can provide personalized advice based on your condition and help you navigate the world of nuts in a way that won't upset your gallbladder. So, in the nutshell, pun intended, while pistachios are a healthy snack for many, they might not be the best choice for everyone. Those with gallbladder disease might do well to limit their pistachio intake. Scene script. Thirdly, let's look at diverticulitis, a digestive disorder that requires a careful diet. Diverticulitis is a condition that arises when tiny pouches, known as diverticula, developed in the lining of the digestive system, become inflamed or infected. Most often these pouches are in the large intestine, a part of the digestive system where we do not want inflammation or infection. When this occurs, it can cause severe abdominal pain, fever, nausea, and a marked change in your bowel habits. Now, why should someone with diverticulitis be cautious about including pistachios in their diet? The answer lies in the nature of the diet that is typically recommended during a diverticulitis flare-up. Doctors usually recommend a low-residue, low-fiber diet to give the digestive tract a chance to rest and heal. Pistachios, while nutritious and delicious, are high in dietary fiber. Fiber is normally beneficial for digestive health, but during a diverticulitis flare, it can exacerbate symptoms and delay healing. The hard, indigestible parts of the pistachio, like the shell remnants, can also potentially irritate the diverticula. Additionally, the high-fat content in pistachios can stimulate contractions in the intestine, potentially leading to discomfort or even pain for individuals experiencing a diverticulitis flare. So, despite their many health benefits, pistachios might not be the best snack choice for those dealing with diverticulitis, especially during a flare. It's crucial to listen to your body and your doctor's advice. Remember, every body is unique, and what works for one person may not work for another. If you have diverticulitis, consult with your healthcare provider or a registered dietitian to help you devise a diet plan that suits your individual needs and helps manage your condition effectively. Therefore, during diverticulitis flares, it's best to steer clear of pistachios. Moving on to kidney and liver diseases, where diet restrictions often apply, these two vital organs, the kidneys and the liver, are heavily involved in the body's detoxification processes. They work tirelessly to filter out waste and toxins from our bloodstream, keeping us healthy and well. When these organs are compromised due to health conditions, it's crucial to follow specific diets that are often tasked with limiting the intake of certain nutrients like potassium, phosphorus, and sodium. The reason behind this? Well, these minerals can build up in the bloodstream when the kidneys or liver aren't functioning optimally, leading to potentially serious health complications. Now let's bring pistachios into the picture. Beloved by many for their unique flavor and impressive nutrient profile, pistachios, like many other nuts, are relatively high in potassium, phosphorus, and sodium. This might sound like great news for the average person, but for someone with kidney or liver disease, these nutrients can pose a potential risk. Why so? Well, consuming foods high in these nutrients can exacerbate existing health conditions, causing further strain on these organs. This is why many individuals with kidney or liver disease are advised to monitor their intake of foods like pistachios. But don't despair, pistachio lovers. This doesn't mean you have to avoid pistachios entirely. Remember, moderation is the key here. You can still enjoy these tasty nuts, but it's important to do so in moderation and under the guidance of a healthcare professional. They'll be able to give you personalized advice based on your individual health situation. In the end, it all comes down to balance, understanding your body, and making informed dietary choices that support your overall health. So, while pistachios have many health benefits, they might not be the best choice for everyone, especially those with kidney or liver disease. And so for those with kidney or liver disease, moderation is key when it comes to pistachios. Lastly, we'll discuss the potential for pistachios to interact with certain medications. Much like a surprising plot twist in your favorite movie, food and drugs can sometimes interact in unexpected ways. In the case of pistachios, their high-fat content can play a starring role in these interactions. You see, certain medications are absorbed in your body at different rates depending on what you eat. The fats in pistachios can slow down this absorption process, potentially altering the effectiveness of some medications. This is particularly true for high-risk medications like blood thinners. Therefore, it's essential to cross-check any drug nutrient guidelines your doctor or pharmacist may provide. These guidelines are like a roadmap for navigating the complex world of medication and diet interactions. So, if you're on certain high-risk medications, you might need to avoid pistachios altogether. As we've seen, while pistachios can be a healthy snack for many, they're not for everyone. They can cause allergic reactions, exacerbate gallbladder disease, trigger diverticulitis flares, and interact with certain medications. Those with kidney or liver disease may also need to moderate their intake due to the high levels of potassium, phosphorus, and sodium. It's crucial to be conscious of your individual dietary needs and restrictions. Always consult with a healthcare professional before making significant changes to your diet.